Compartment syndrome. Compartment syndrome is a painful condition with muscle pressure that reaching dangerous level. Like acute compartment syndrome is a medical emergency that is usually caused by trauma like a car accident or broken bone. Chronic compartment syndrome is caused by intense repetitive exercise and usually stop with rest or change in routine. Compartment syndrome occurs when pressure rises in and around the muscles. The pressure is painful and can be dangerous. So, there are different types of compartment syndrome. The first one is acute compartment syndrome that is caused by bad injury and is a medical emergency. Without treatment, acute compartment syndrome can permanently damage the muscles. It can lead to disability, paralysis, or even death. In chronic compartment syndrome, usually isn't an emergency. It's often caused by physical exertion, such as intense exercise. Now, what are the causes for compartment syndrome? A serious injury or too much physical exertion can cause swelling or bleeding in a compartment. So the fascia won't expand. So the swelling or bleeding puts pressure on the nerve and muscles. If the pressure gets too high, the tissue can't get enough blood which contain oxygen and nutrient. The tissue can die and leading to permanent damage to that area. Like some are examples of injuries that can cause compartment syndrome. First one is badly bruised muscle, car accident, crush injury, fracture, broken bone, or anabolic steroid can also the compartment syndrome by increasing muscle size too quickly. What are the symptoms of a compartment syndrome? The mainly symptoms are visible swelling of the muscle, feeling like the muscle is fluffer or swollen, numbness, muscle pain that is stronger than you would expect from injury, severe pain when you stretch the muscle, tightens the muscle, tingling or burning sensation in that area. We can diagnose by physical examination. Physical examination, the signs of inflammation or signs of check for tendons like tendinitis is also present. In X-ray, we have to see whether is their fracture is present or not. Compartment pressure measurement. The provider will insert a needle into the muscle. A machine attached to needle will give the pressure reading. So, how to treat acute compartment syndrome? Must get immediate treatment. A surgeon will perform an operation called a fasciotomy. To relieve pressure, the surgeon makes an incision through the skin and the fascia. After the swelling and pressure go away, the surgeon will close the incision. So, some anti-inflammatory medications like NSAIDs also we can use. Cross training, low impact exercise like physical therapy or softener surface for workout like running or track instead of concrete, for example. So that's all about the compartment syndrome.